Hi everybody, I'm Dr. Neha Sood. I'm Principal Consultant, Department of ENT and Cochlear Implant at BLK-Max Super Speciality Hospital. On this occasion of World Hearing Day, I'm here today to talk to you about hearing loss especially in children and its implications in the lives of these growing children, and some ways how we can prevent this from happening, and also some ways in which we can give them hearing, give them normal lives like their contemporaries in their schools or at their homes. So hearing, as you know, is a very important sensory input which we get from the environment, from people around us, from various sounds. So hearing helps us get educated. It helps us develop speech. As the children are growing, they hear sounds, they learn from that. Also, when children hear you talk, that's how they develop speech. All children who do not have hearing or develop a hearing loss as they grow older will fail to develop speech. And this becomes a huge problem in our society, because if these children fail to develop speech, they will not be able to go to normal schools, they will not get educated, and as they grow older, they will not develop any career or will not go ahead and get good jobs. So all these children, as they are growing, or in their younger years between 1 to 5, that's when they develop speech. And small little things at home will give us warning signs whether the child is hearing or not hearing. We advise parents to watch out for those signs and come to the doctors or ENT specialist or a pediatrician as early as possible. In case your child has had any other problem, any other syndrome or any other congenital malformations, then these children are at a higher risk of developing hearing loss. Mothers who've had any kind of infections during pregnancy, especially the TORCH group of infections, children born to these mothers have a high index of suspicion that they will develop hearing loss. Once we know a child is not hearing, what can we do? What should we do? When you go to your doctor will examine the child, talk to the child, see how the child is responding, and go ahead and get some tests done. The first test we do in children would be a BERA test, which gives us the hearing level of the child. So we can actually find out whether the hearing is normal or there is a problem with the hearing, and then we can go ahead and start the treatment. Now I'm here today to stress on the fact that we need to identify these children very early in life, because as we grow older, our ability to develop speech starts deteriorating. So after 5, even if we give these children hearing, they will fail to develop any speech. So it has to be done as early as possible so that they can lead normal lives. So the take-home message on this World Hearing Day would be early screening, early diagnosis, and early management to treat hearing loss in all these children. Thank you.